Hey, everybody. I have the privilege of being joined by Dr. Mike Bauerschmidt. Mike's been using LiveO2 for a decade, thereabouts, maybe more. And so we've had some questions come to us regarding what in the world's going on with this blood saturation, because there's some patterns that we see that nobody seems to know about. So I thought it would be helpful if Mike and I got on here and started talking about what we think is physiologically happening in terms of the oximetry. So the first thing I want to point out in this whole conversation is this oximetry discussion, at least the first part of it, happens only when you're breathing oxygen.
Correct.
So, okay. So now there's a variant of that, but we'll get into that in a minute. So the patterns we're going to go through here are the 99er, the initial dipper, the asymmetric oximetry, and anaerobic. And then we're finally going to get into functional desaturation. So, Mike, which one would you like to start with?
Oh, let's do asymmetric. What the heck? We'll do it alphabetically if you like, or or no. Actually, the people that won't desaturate is probably one that's the most frustrating to try to deal with when you first start using LiveO2 system. At least I found it that way.
Well, if we're playing tennis, I'm just going to smack the ball.
Okay.
So inside LiveO2, if you want to find, these references, it's called the 99er pattern, because normally you put them on there and they'll hold at 99, and no matter what you do, they don't change. And so the model is, of course, and these people usually have various fatigue syndromes, and that their vascular system is really poor at releasing. Okay, meaning blood's not moving. So like one time, my first 99er was a lady that had chemotherapy earlier that day. And my goodness, we had to work hard to get her opened up enough. So the physiology that I'll suggest, and please join in if you like, is that when you've got so much capillary inflammation that the red blood cells can't go through the capillaries, it basically just travels around the circuit and never gets to dump any oxygen.
Well, that's exactly correct, I think, Mark, because these folks I deal with mostly toxic patients, chemicals, metals, molds, EMFs, spike proteins, what have you. And the common denominator in all this is inflammation. And you got to remember when we're doing the pulse ox, I remind myself of this every once in a while too. The pulse ox is just looking at the very distal part of your circulation. I mean, if anything's going to be inflamed, if anything's going to be blocked, it's going to have trouble getting down to that capillary bed in your nails. And so you may not be getting a true reading of what's actually happening physiologically, because I've seen these 99ers, they're huffing and they're puffing, and you're going, how can your pulse ox still be 98, 99, even 96 at altitude? And I think you're exactly right. It's just this issue of inflammation, and I think our goal should be, what do we need to do? The question we should ask is, why isn't their pulse ox dropping? The question we should be asking is, what is blocking the oxygen from getting to the cells so they can open up the capillaries and we can reduce the inflammation? Because bottom line for me, oxygen is the great healer. If you don't have the oxygen, aerobic metabolism can't take place. Aerobic metabolism can't take place. Your energy conversion goes to anaerobic, and it's just a hot mess.
Right. Well, let me offer some functional guidance to people that see this pattern, which is you and I think we both do the same thing, which is when you get these people that are stuck, basically their capillaries are so choked off. And what you want to do is ram the blood harder in hopes that you can break through. Mm-hmm. So my normal protocol for 99ers is I'll start, gradually exposing them to low oxygen air and push them a little bit within their tolerance in the hope that you can kind of start to see them break loose. So I'll know I've succeeded when I see the PO2 actually drop. And I think this leads to a good entryway into the next topic, which would be the initial dipper.
Right.
So if we talk about our 99er and you finally break through, what you will normally see is a big dip in their PO2. I've seen it go as low as 65. I heard a story about somebody who was particularly ill that had it go down in the 30s or 40s. And so another thing that we would want to go into is like, well, when you see this, it's actually a good thing because this person's not in distress. They're in front of you working out. But what's happening there, in my opinion, and you can respond, is that you broke through, but the tissue that was being supplied by those capillaries that opened up have been oxygen hungry for a very long time. So that blood that's going through there has all the oxygen on it gobbled up. Mm-hmm. So you will see a long-term. So when I do these 99ers or even anybody, I'm always looking at the length and duration of the dip that they go through while they're breathing oxygen afterwards. So Mike, let me throw you the ball. What's your strategy?
Yeah, well, and actually, that was one of the first things that I train people to run my cleanse operation using the LiveO2 or LiveO2, and they one of their first questions is, what the heck happened? I gave them the oxygen back and their oxygen went down. And I kind of went, yeah, good. They went, why? What do you mean? What's happening? And, from my perspective, what I see as well, and I think, what you're saying is indeed correct. But there's also, I think, the admixture, because as you're exercising and you place them at altitude, your body will start to shunt the blood away from the areas that don't need it, like the intestinal tract and shove it to the periphery and the heart and the muscles. And then when you give the oxygen back, you've reversed that shunt, if you will, and now all this oxygen poor blood that has been used up by the intestinal tract and spleen and liver and all has now just admixed into that oxygen-rich blood and dropped the PO2 overall. Mm-hmm. I think is the other explanation. At least that's what I've been telling my folks.
Well, the truth is we can't really see, but from a person who's working with somebody in front of you, once, and I use the phrase degrees of freedom, mm-hmm. Once you get the vascular system working more like it's supposed to, then what you'll see is them feel better and respond better. So each of these patterns that you see tends to be some sort of breakthrough event. When you see it, it's a good thing. Yeah. And that, I think the important thing to really pin to the wall here is when you see the pulse oximeter say a low number, you're looking at the oxygen that's in the blood, as in you're looking at how much cash is in the Wells Fargo truck mm-hmm. on the way back from your cell. And the empty Wells Fargo trucks often mean that the cash got dumped where it was supposed to go. So a low PO2, especially in the cycle, is often a good indicator that you've restored metabolism to cells.
Yeah. And in the world of environmental medicine, we've used venous PO2 as an indicator of how well the cells are extracting oxygen, or oxygen is being able to be delivered to the cells. And if we're seeing PO2s, venous PO2s above 25 to 27 range, we know that we've got a serious inflammatory response. And just as soon as I can afford a blood gas machine, I'm going to start measuring this stuff before and after the LiveO2 and see what kind of results we get.
Excellent. I think I have some references I'll put in here. So I'm going to pretend we can see this, but we do have a graph that has somebody with a cold or a flu that basically is going through a oxygen system or an oxygen cycle. So the graph starts out with their energy production normal, then the cold or flu sets in, their oxygen utilization. And this graph uses the AVO2, arterial-venous O2 differential, meaning mm-hmm. if there's a lot in the artery and a lot in the vein, then not much is getting delivered. But when these converge, the amount that's delivered causes those to go together. So a close band, or you're really looking at the amount of oxygen used. So while we're going through this, anything that restores it, I'll put this up later, but basically when you look at the AVO2 graphs before and after a cold or a flu or surgery or any sort of trauma, you'll see that AVO2, or the actual energy that's produced by the cells, i.e. the amount of oxygen the cells use, actually decreases. And that when you use LiveO2 or oxygen training, what happens is that will open back up and you'll restore. So this particular graph shows that there's roughly a 48% increase, durable increase in energy production for somebody that's got flu that kicks in as soon as they get off the system. And it actually develops over the next, I think it's like the next 6 days, where their core energy production goes to about 140% of normal.
Yeah, that's fascinating, and that's exactly why I'll have people come in with respiratory illness. I'll put them on the machine.
Well, that's a good one.
Yeah.
So, all right, I want to keep us on track, and then we can go visit people that have respiratory challenges like asthma and other things. So, one of the next ones that's I'll call it a asymmetric oximetry. So a lot of times when we train people, we'll put a PO2 meter on the left and on the right. And when they start to work out, particularly on oxygen, as they're going through the early part, you'll see the left or the right side just plummet and the other side is normal. Okay. And to me, that's fascinating. I will usually do that when I'm educating a physician, because that gives me a artifact or an observable. It says, look, something on the left side of your body is jacked up and it's getting fixed right now, which is, the same thing we're talking about with the initial dipper, which is the side of the body that ends up having the lowest, actually has the greatest oxygen consumption, and that oxygen consumption is a plus. So and I mean, if you're only looking on one PO2, then you're going to assume the PO2 is uniform throughout the body, which, like you said earlier. So why don't you comment on that, if you would, please? Oh,
yeah. Well, it's interesting, Mike, because I routinely put 3 pulse oximeters on me when I do it. And I'll do my left index and my left ring finger, and then my right index finger or middle finger, so I can still control I use a treadmill, so I can still control I still have control. But I will have not only a difference between the left hand and right hand, but also a difference on my left hand between the 2 fingers that I'm using. It's usually not as dramatic as one side to the other. And I think part of it is the sensitivity of the particular. I have 3 different sensors. Some are more sensitive to motion artifact than others. So I think there's probably a degree of variability just because of the differences in the sensors that are used. But also, it's interesting what you bring up about the asymmetry of the organs, because the anatomists will teach us that the whole head and the right side of the body or the right arm and basically the right upper thorax are drained through one system, and the left side, everything else is drained through the other. So if you've got this asymmetry, can you reasonably then assert that, well, if my right side's so much lower than my left side, my brain's much more involved, or is extracting oxygen much better than the left side? Or is there something on the left side that my brain's fine, but the left side is suboptimal? So it's actually a fascinating thing that I haven't had a good explanation for. But if you've got one, I'm all ears.
Well, I want to jump in here and just kind of show this as part of the stream, this is a real-time brain oxygen utilization graph, where we used a device like this. It's called a Moxie. It was by a different company. But what we're looking here, and I don't want to go this, but the principle here is, as we're seeing this oxygen saturation variability, really we're looking here kind of at the same thing, which is you can watch the body desaturate, resaturate, desaturate, resaturate, and that by putting it through the degree of freedom, you're actually restoring blood flow to and through the brain by acting and driving the system. Okay, so when you see these asymmetric events on the body where one side dips, you're basically busting through obstruction to oxygen delivery. And, like in this case, the point is, by the time I finished the workout, my brain was manufacturing 29% more energy than it was when I started. And so, but that happens throughout the body. So when you see these patterns, it's really a good thing. So anyway, I don't know, Mike, you want to comment on that?
Well, no, this is very interesting graph. I was not aware of the existence of this sucker, but it makes absolute sense because really, from my perspective, what the thing that I love about the LiveO2 is by combining the exercise with the oxygen and then the hypoxic and the altitude contrast component, you're really creating an increase in vascular dilatation and heart rate, which creates turbulent flow, which supersaturates the plasma with oxygen, which increases the driving power. And also you're increasing the pulse pressure because of the exercise, so that you're actually driving this oxygen-enriched blood deeper into the tissues. So this graph doesn't surprise me one little bit. I'm just happy to see that, that it's actually been documented that what I believe is happening is really happening. And it certainly explains a lot about why my patients get so much better.
Right. Well, I'm going to show you another graph. So that's sort of a nerd graph talking about blood flow. And I'm going to show you another one. So, like with respect to the brain, what you really care about is how well the brain works. And I'm going to highlight this because this was our very first, I'll call it, person where we saw this massive breakthrough. So this lady had a series of 3 concussions over 18 months. And I said, hey, come on over. Maybe I can help you. So this is a test by an outfit called CNSVS, and that she was just miserable. So the first test we did was at 11:13 in the morning. We gave her this neurological panel, and you can see the reds really are cognitive scores in the first 1 to 5 percentiles. So she really is not doing very well in any of these. So we trained her for, 30 minutes, but she got on the bike and she was just like, wow, man, this feels good. Rah! She tore it up. She just she was 50 years old. Like, oh yeah, whatever. Man, she just rocked it. I'm like, okay, so you enjoying that, Jill? She says, yeah, let me have it. I'm like, okay. So anyway, we got to the end and then basically she's sitting in front of a tree in my yard. And she reaches around the back of her head. She says, yeah, boy, that's got a nice tingly sensation. And I'd seen this before. I was like, well, that's probably blood flow being restored to that area. And I'm like sitting there and I'm like, I wonder. So I said, Jill, would you mind taking another one of those tests? And she said, Mark, that sucked. But you know what? I feel good enough. I think I can do it. Long story short, the second test is 2 hours later, 11:13 for the first test and 1:21. So there's literally 2 hours difference. And you see the 45 to 110, she's a very smart lady. And so what happened is as she was sitting there and as she did the training, the blood flow came back. And not only that, she basically had a functional recovery right there in front of me. So this is, again, the same thing. And this is where basically what I call the LiveO2 protocol. But it's really based on the same principle, which is you activate the system, you push through, and once that stuff opens up, the tissue, as long as it hadn't been offline too long, will kick back on. And, this is another documentation. I'm sure you've seen this, hadn't you?
Oh, yeah. This I've seen several. I've had several concussed patients that have done extraordinarily well with the LiveO2. And also this is very consistent with what we know about things like heart attacks and strokes, where after an ischemic event, you have tissue that's permanently damaged. You have tissue that's permanently undamaged, or at least undamaged for the foreseeable future. But then you always have that penumbra of tissue that could go either way. And I think what you're seeing here is that rescue event. I find the only thing I find what was kind of interesting is her psychomotor speed and her motor speed didn't change much, and she actually just went down a little on the verbal memory. But she had across the board improvement in so many other parameters. It's clearly something good. So I was wondering what it would have been. If you go
to the next row in the table, what you're looking is long-term dynamics. We actually tested her 4 years later.
Oh, I don't see another. I don't have the other row.
The one I just had this on my desktop. So we did a 4-year longitudinal 2017, and she was still substantially green. But as we've worked with veterans and others, what we've seen is that you end up with what I'll call it a neurocognitive initial dipper. because when you bust loose or bust through in the brain and somebody's been concussed for 5 or more years, what happens is their scores will drop for about a week until the brain realizes it needs to turn that circuitry back on.
Exactly. And we had this all the time in the emergency room when I worked ER, and it was back in the days when people would come in with sky-high blood pressures and we'd squirt nifedipine underneath their tongue to drop their pressure quickly. And sure enough, the next day they come in with a heart attack. Because, we dropped the blood pressure, but we dropped the pulse pressure in the areas that were, we basically unmasked underlying disease.
Right. And so the high blood pressure, hypertension was a compensatory mechanism.
Yeah.
To stick with your question, what happens is as you go through this recovery, what you're really looking at here is longitudinal blood flow differentials. And you'll have people that just have slow nervous systems.
Sure.
Okay, which is, I'll call it organic. So when you're looking at these, you'll tend to see an increase across the board. And I will speak to the composite memory and verbal memory in the last row. What we discovered after administering this test, depending on how smart somebody is, like she is very good, almost perfect visual memory, is that there wasn't enough time between 8:27 and 9:03 for her memory of the first set of symbols to wash out of her mind. So when her mind kicked back on, she remembered both sets, so she was confused. So this dip in the neurocognitive elements is a result of, you really kicked the sucker on. So you can't always take the drop in, particularly the memory, because people have different durations of memory.
Right.
All right. So I want to kind of stay on track because.
I'm sorry, because I'm not a neurobiologist, and though I think I was one in a previous life or something. I don't know.
Well, the point I would make is, when you get into the adaptive contrast that basically enables you to establish the circuit is the functionality that enables you to get results like this, because you can blast through the obstructions.
Yep.
And so when you blast through the obstructions, like, and you have the opening events that causes the blood to be restored, the brain that's just now got oxygen to it is going to suck up a boatload of oxygen. And like you said, the stagnant blood that was behind those occluded areas is going to wash free. And so you're going to have two things: overconsumption as well as low oxygen blood and waste washing into the system. So, and the waste washing into the system going to the liver can also drop the PO2 on the right side as the liver cleans up the mess that you just dumped on the kitchen floor.
Yep.
You've seen that, right?
Oh, God, yes. I see that every day in the cleansing operation. Absolutely. The oxygen is a great, your cells, the hardest part of getting rid of any toxin is getting it out of the cell. And you're not going to do it if your aerobic metabolism is shut down. And you're never going to do it if you don't do something about the reduced oxygen consumption on the cellular level. And most of that has to do not with reduced consumption, but reduced delivery. You improve the delivery, then the body can start using it, and that's when the magic starts to happen.
Yeah, I wanted to jump down that aerobic thing a little bit because, in terms of helping people that use LiveO2 understand the difference between aerobic versus anaerobic. Okay, and I'm going to offer up a concept that, we also do, particularly me, and you said this morning, also, we like to do anaerobic training. Okay, and so once you've got the hang of this pulse oximetry, you can tell when you go anaerobic. So my transition anaerobic is I'll get on there and I'll be yamming on minus O2 at some absurd altitude. And then all of a sudden my PO2 will go chunk, 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 down, down, down. And then I'll reach a point where it pops back up. So I'll go down to typically 81 and then it'll pop up to 84. And the time I dwell at the 84 gives me the duration of my anaerobic session or anaerobic challenge. The model there is, once you use up all the quote unquote available oxygen, then the body's like, okay, I'm switching to anaerobic. And then you'll stay in that position until you switch back to oxygen. Then what happens is it'll drop from 84 down to about 75 as you pay back the massive deficit that you've created. And then you start to pop back up. So from a training quality point of view, if you look at the velocity of that recovery cycle, then you'd be like, okay, now you can kind of get a yardstick about what kind of good the anaerobic training is doing. Let me throw the ball to you in terms of that.
Oh, gosh. That's actually, as I was sitting here just remember the first time it happened to me, and I'm going, what in God's holy name is happening here? Because I'm like, and I felt so good after that. But it's, again, it makes, physiologically, it makes absolute sense. And, I don't have many people in my office that I let do that because they're too fragile, and I'm trying to get things turned back on and not teach them how to be better sports people. So I try to avoid. I push myself because I can, but my patients, I generally don't take down that road because they're just too sick to begin with, and I want them back in aerobic metabolism as much as possible. So I'll take them down and bring them back up. I try to keep them out of that anaerobic state, but certainly for people who are doing it for athletic training or to be able to tolerate high CO2 levels, absolutely, love it. I do so much. After I've did it for a while, I discovered that my recovery time has improved dramatically as well. Just personally, when I've hit that, just doing regular sessions for a body flush, I'll recover. I'll start with my pulse in the 70s. I'll get it up to I'll push myself up into the 140s. During the cool down period, I'll be back down below 100 within a couple of minutes.
Well, I think we're kind of scratching on another one, which kind of gets into a notion that people who are watching this would want to know. So a big percentage of our customers are like you. Okay, you get it because you want to use it for yourself, and your initial use case is like, hey man, I got something wrong. I want to get a hyperbaric chamber. I need to do something. Okay, and so I invented the original oxygen reservoir system, but we ended up deciding it was almost unethical to sell those except in rare cases. And the reason for that is the long-term utility of oxygen-only systems, because you get on there, you breathe the oxygen, you run out of oxygen, you're done. Mm-hmm. What happens is if you're a user of LiveO2, I mean, I've been training on it for a decade or more. I did an interview with a fellow last week that also had been one of our oldest users. He started in 2014. And so the point here, as you get stronger, like you, what happens is you're like, okay, LiveO2 transitions from a quote unquote recovery platform to a long-term athletic training program. So we have multiple customers that, have basically gone to Camp 4. They're virtually immune to altitude sickness. They don't need oxygen, etc., because the conditioning you get out of LiveO2 also makes it a premier athletic training platform. So if you're a doctor like Mike here, what happens is you get greedy with how much you can get done with it.
Exactly. Exactly. Because I would not be able to help the people I can help were it not for the LiveO2 and the altitude contrast component of LiveO2, because there are things called oxygen toxicity. And I've had people that have come to me after they've done 40, 50, 60 hyperbaric chamber treatments. They feel better for a time, but it doesn't last because they're not getting any kind of cardiovascular conditioning. They're not teaching their body how to deal with low oxygen levels, or not tolerant of higher CO2 levels. And it's just not as effective. Not to mention, well, actually, expensive.
Do you mind if I jump down that rabbit hole a bit?
No, go ahead.
Okay, so when you go in a hyperbaric chamber, and this would be good for the audience, it's like, it's compressing the air around you, and your body's like a sponge. Okay, so you will increase the oxygen in your body proportional to the increase in partial pressure of whatever it is. Okay, the issue, though, is when you come out of the hyperbaric chamber an hour or 2 hours later, you've come back into a partial pressure environment that's ambient. Okay, so you feel good as long or until your body uses up the extra oxygen that you squeezed in there. Mm. Okay, LiveO2 is different because what we're actually doing here is we're basically ramming the blood through, and we're delivering oxygen in the form of Drano to open up the vascular system. So like I showed you the lady with the improved cognitive function here. And you can see that with no workouts, her neurological panel stayed higher in this case from the 27th through the 3rd, which is about 6 days. Okay, that doesn't last. And the reality is once we tested her 4 years later, her results were still durable because we actually fixed the blood flow in her brain. And we did a test or a case, I don't know, a couple of months ago. We actually had a lady that had a concussion recovery after 41 years. Again, same mechanism. Wow. And it's on our oxygen library. But, we did the same before, after neurological panel differential, showing her low before. She had to condition for 2-3 weeks. Then she came in. We did an aggressive protocol with her where we could really spin her up. And sure enough, she broke loose. And all of a sudden, she's high scores are there and holding.
Yeah, actually, Mark, that's an interesting point you raised, because I'm assuming that if people are familiar with LiveO2, they're familiar with Dr. Von Arden, who kind of started this whole thing with the oxygen multi-step therapy. And in his thing, he was able to take 10 years off the perfusion differential in older people by 10 to 20 years with just one treatment, and he could get permanent reversal of what he called a physiologic switch after 20 to 25. So I'm curious, as in terms of durability, this sounds, with this particular patient, it sounds remarkable. How many treatments did she actually go through to get to that point of sustained durability?
This lady right here, I'm sharing the panel. Mm-hmm. 2.
Really?
Yeah.
2 treatments?
Yeah, I did a neurological panel. Let's see, we did 1, 2. Yeah, so you can see that on the 2nd and 3rd treatment, she was still holding flat.
Yeah,
so we trained her a couple of times, and she continued to feel better and gain ground. But the ground she gained in the last 2 sessions was small compared to the first. But she was just so happy to get a life back that she didn't really care. It's like, I'll come see you every week.
Yeah.
But we didn't need it, because,
right.
Once the job was done, she had her quality of life back and she could go back to, doing her thing.
Wow. Because and the reason I bring that up is people will ask me, well, how long do I have to do this for? How many do I have to do? And I generally recommend 3 times a week for 4 weeks is a kind of a package that I have people do. Or if they're here for, serious environmental illness, I'll have them do it every day for a couple of weeks, along with some other stuff that I do. But when they leave, many of them are kind of like, can I take this with me, please? I say, call this number and order one for yourself. Because it is for home use. There's nothing like it. There's nothing. You can spend twice the amount of money on a hyperbaric chamber and not get anywhere near the results.
Yeah, the whole amount of time you have to do that. And this is kind of a typical pattern for our users. So, can you think of anything else we ought to visit?
No, not really. I think I'm pretty good. Let me see. We covered the patterns and even down to the anaerobic. So I'm happy. I'm happy. I have the LiveO2. I'm happy I use it, and I'm happy for myself, and I'm happy for my patients. So God love you, Mark.
Well, thank you for being here, Mike.